Welcome to the deep dive.
Here.
Ever feel like pet health throws a curveball and suddenly you're wading through confusing medical terms?
It happens all the time.
Yeah. So today, we're tackling one of those, hypoparathyroidism. We'll break down what happens when a tiny hormone goes missing and, how it impacts our dogs and cats.
Exactly. We've got some really insightful material from canine and feline hypoparathyroidism that we're going to unpack for you.
Great.
Our goal is simple, really. Just to give you a clear understanding of this condition, what causes it, the warning signs to look for, and how it's managed.
Skipping the heavy jargon.
Yeah, we're skipping the heavy medical jargon and getting straight to what you really need to know.
Okay, so hypoparathyroidism. In plain language, this is when the body doesn't have enough parathyroid hormone. That's the core of it.
That's it. And the really crucial thing to understand is that this shortage, well, it messes with calcium levels in the blood.
Right.
Leading to what's called hypocalcemia, low calcium.
Oh, calcium, got it.
Precisely. Now, what's fascinating here is that the reasons behind this hormone shortage tend to differ quite a bit between dogs and cats.
Oh, really? How so?
Well, in dogs, the most common cause is this condition called idiopathic immune-mediated parathyroiditis. Bit of a mouthful, I know.
Huh, yeah. What does that mean, basically?
Think of it like this. For some unknown reason, that's the idiopathic part. The dog's immune system gets confused and starts attacking its own parathyroid glands.
Wow, their own body turning against itself. That sounds pretty serious. What about cats? Is it the same kind of thing?
Interestingly, no, not usually. In cats, the most frequent trigger is actually a result of medical treatment. It's what we call iatrogenic.
Iatrogenic, meaning caused by treatment.
Exactly. It often happens after a surgery to remove the thyroid glands, a procedure called a thyroidectomy. Usually that's done to treat an overactive hyperthyroidism.
Okay.
And sometimes during that delicate surgery, the nearby parathyroid glands, they're tiny and right next door, can get accidentally damaged or even removed. Ah, okay. So it's a complication of another necessary procedure.
Often, yes. It's worth noting that cats can very rarely get hypoparathyroidism on their own, either due to the parathyroid glands shrinking for no clear reason, or, less commonly, through an immune issue similar to what we see in dogs.
But that's much rarer in cats.
Much rarer. The big takeaway here is that fundamental difference in the most common cause. In dogs, it's often their own body turning on itself, while in cats, it's more frequently a consequence of that thyroid surgery.
That completely changes how you might think about risk factors, doesn't it?
Absolutely.
So this parathyroid hormone, even though it sounds small and maybe not that important, it actually has a huge job, right? What exactly does it do when it's working properly?
Its main role, its key function, is to keep the calcium levels in the blood in a very tight and healthy range.
And calcium's important for it.
Oh, so many things. From nerves and muscles working correctly to keeping bones strong. When there isn't enough parathyroid hormone, that delicate balance of calcium gets thrown off and the levels drop too low. And this calcium drop isn't just a minor thing. It can have really widespread effects throughout the body, according to our sources.
Exactly. Because calcium is so vital, a lack of parathyroid hormone can really throw things out of whack in various parts of the body.
Like what?
For instance, the heart's electrical activity can change, sometimes leading to a slower heart rate. The digestive system might get upset, causing like a loss of appetite and vomiting.
Okay.
But it's often the nervous system and muscles that show the most obvious signs.
Such as?
Like seizures, muscle spasms, which can look really alarming, tetany, uncoordinated movement, and just general weakness. It's all because those nerves and muscles become overexcitable without the right calcium levels.
That sounds incredibly distressing for the pets and for the owners watching. And it's not just those systems, is it? I remember reading about potential eye problems, too.
That's right. Some animals with hypoparathyroidism can develop cataracts, specifically at the back of the lens of their eye, posterior lenticular cataracts.
Interesting. And changes in drinking and urination?
Yes, interestingly, we can also see an increase in both urination and thirst. PUPD, we call it. Although the exact reasons behind this in this specific condition aren't completely clear, it's one of those things where we see the symptom, but the exact chain of events isn't fully mapped out yet. Some pets might also pant more than usual. That could be due to a combination of muscle weakness and maybe some anxiety related to all the other changes they're experiencing.
Quite a list of potential issues. And it sounds like we don't really know if genetics play a big role in either dogs or cats getting this on their own, like the spontaneous kind.
That's correct. The genetic factors involved in spontaneous hypoparathyroidism, while they haven't been fully identified yet in either species,
So we can't screen for it or anything like that.
not at the moment, no. So while we see it more in certain breeds, we don't have a clear understanding of the specific genes that might make them more susceptible.
Speaking of who's more likely to be affected, our sources give us some interesting info about how common this is and if certain breeds or ages are more at risk.
Yeah, so in the dog world, hypoparathyroidism is considered relatively uncommon. It's hard to pin down exact numbers, actually.
Okay.
Now, when we look at cats, as we discussed, it's more common, but specifically in those who've had both thyroid glands removed.
Right, the iatrogenic cases.
Exactly. Studies show this happening in a significant percentage of those cats, anywhere from like 10% up to over 80%.
Wow, that's a huge range.
It is. It likely depends quite a bit on the specific surgical techniques used. However, if a cat hasn't had that surgery, the chances of them spontaneously developing hyperparathyroidism are really, really low.
Like super rare.
Very rare. We're talking about very few reported cases in the medical literature, so that stark difference in how often we see it is a key thing to remember.
Definitely a key difference.
Yep.
Now, when it comes to specific breeds, are there any that owners should be particularly aware of for their dogs?
Yes, certain dog breeds do seem to pop up more often. These include breeds like toy poodles, miniature schnauzers, German shepherds, Labrador retrievers, and various types of terrier breeds.
Okay, so a mix of small and large breeds there.
Yeah. For cats, it's interesting, in the small number of spontaneous cases, mixed breed cats actually seem to be overrepresented.
That's a bit surprising. You often hear about purebreds having more specific issues.
Mm-hmm.
What about the age when pets are typically diagnosed? Does that vary?
It does, quite a bit. In dogs, the average age at diagnosis is around, 4.8 years old, but we see it in a wide range, from very young puppies, like 6 weeks, up to 13-year-old dogs.
Wow, okay.
When we look at cats, the age picture depends on why they develop the condition.
Right, the cause matters.
Exactly. If it's after a thyroidectomy, it usually shows up in older cats, typically around 12 to 13 years old on average. And we've even seen cases in cats as old as 22.
Goodness, 22.
Yeah. On the other hand, when cats develop hypoparathyroidism on their own, the spontaneous kind, it tends to happen much earlier in life. The average age there is just over 2 years, with a range of about 6 months to 7 years.
So a much, much younger age range for those spontaneous cases in cats.
Definitely. A really significant age difference depending on the cause.
And what about whether it affects males or females more often? Any pattern there?
There is. In dogs, we see a clear trend towards females being more affected. About 60% of cases occur in female dogs.
Okay.
In cats, it's the opposite. Male cats make up around 64% of the reported cases.
Interesting. So some sex-based differences to be aware of, too.
Yep.
Okay, so we're starting to get a clearer picture of which pets might be at higher risk. Now, let's talk about what pet owners might actually see at home that could raise a red flag. What are some of the key historical findings, as our source calls them, the owner's observations?
Right. For dogs, one of the most common things owners report is seizures. We see this in a large percentage of cases, anywhere from roughly half up to 86%.
That's high.
It is. They might also notice their dog being uncoordinated, maybe having a stiff way of walking, or even rubbing their face a lot, which is an interesting one.
Facial rubbing, why is that?
It's thought to be related to tingling sensations, sort of like pins and needles, due to the low calcium affecting the nerves in the face.
Ah, okay. Makes sense.
Yeah. Muscle tremors, twitches, and those little flickering muscle movements under the skin fasciculations are also quite common, maybe around 57% in cases.
Right.
Some dogs might seem more anxious or vocal, maybe growling more than usual, or they might pant excessively. Owners might also report their dogs seeming weak, drinking and urinating more, vomiting, or just not wanting to eat.
So a whole range. But seizures are a big one.
A big one, but it's important to remember they don't happen in every single case. There's variability.
Okay. What about cats? Are the things owners notice initially different for them?
Yes, somewhat. In cats, the most consistently reported signs are lethargy, just being really tired and inactive, a loss of appetite, and seeming generally depressed.
And you said those are really common.
Incredibly common. Interestingly, these were reported in 100% of the cats in the study our source draws from.
100%. Wow.
Yeah, so they are very, very strong indicators in cats. Seizures are also common, occurring in about half of the feline cases.
Okay.
Similar to dogs, owners might observe muscle trembling, twitching, and fasciculations that happens in most cats, maybe over 80%. Panting and a noticeably slow heart rate, bradycardia, might also be seen, though perhaps less frequently than some of the other signs.
That very high percentage of just being off lethargic and not eating is really key for cat owners.
Absolutely. Something really important for owners and vets to keep in mind for cats with this condition.
Definitely important to note. So those are the things an owner might pick up on at home. What might a veterinarian find when they do a physical examination? Any specific clues?
There can be. In dogs, a vet might feel a tense or even rigid abdomen in a good number of cases, maybe 50–65%. The uncoordinated movement or stiff gait that owners might have noticed could also be apparent during the exam.
Okay.
Interestingly, a fever is quite common in dogs with this condition, although the reported range varies quite a bit, like 30% to 70%.
That's a wide range.
It is. The muscle tremors, twitches, and fasciculations we talked about as owner observations will likely be seen by the vet as well in over half the cases. They might also notice the dog panting.
And the eye issue.
Yes. One specific physical finding that can really point towards hypoparathyroidism is the presence of those posterior lenticular cataracts in the eyes, seen in maybe 15–32% of dogs.
Right.
But here's a really crucial point. Up to 20% of dogs with hypoparathyroidism might have a completely normal physical examination.
Wow, 1 in 5 could look totally fine on exam.
Exactly, which just highlights how tricky this can be to diagnose sometimes based on the physical exam alone.
That must make diagnosis quite challenging for vets in practice. What about the physical exam findings in cats? Similar things.
In cats, similar to what owners see, vets will often observe muscle trembling, twitching, and fasciculations, again, very common, over 80%. Panting and those posterior lenticular cataracts can also be present in a notable number of cases, maybe a third. A slow heart rate might be detected. And surprisingly, both fever and a low body temperature, hypothermia, have been documented in some feline cases, though less commonly, maybe around 17% for each.
Given that the signs of hypoparathyroidism can be so diverse and can overlap with so many other health issues, how do veterinarians actually figure out if this is the underlying problem? It sounds complicated.
It can be. That's where the process of differential diagnosis comes into play. It's really important.
Differential diagnosis, meaning looking at all the possibilities.
Exactly. Because the symptoms we've discussed aren't specific just to hypoparathyroidism, vets have to systematically consider and rule out other conditions that could be causing similar signs. It's a bit like detective work, really.
So if a dog is having seizures, for example, it could be a lot of different things, right? Not just this.
Absolutely. A vet would need to think about, well, heart-related issues that could cause fainting spells, which can look like seizures, various metabolic problems like liver disease affecting the brain or dangerously low blood sugar, and then a whole range of neurological conditions, epilepsy, brain tumors, exposure to toxins, or inflammation in the brain itself. Lots to consider.
And if the main sign is weakness, what else is on that list?
Again, a long list. Could be heart problems like congenital defects or heart failure, metabolic issues like Addison's disease, low blood sugar again, anemia, low potassium, especially something to think about in cats, low thyroid function, hypothyroidism can cause weakness too.
Right.
And then different nerve or muscle disorders, things like myasthenia gravis, muscle inflammation, neuropathies, even things like tic paralysis, botulism, or certain types of poisoning.
Goodness. It sounds like quite the process of elimination. And what about those muscle tremors and twitching? What else could be causing those specific signs?
For those signs, vets would consider other metabolic causes of low calcium first, like eclampsia in nursing mothers, low calcium after giving birth, as well as other causes of hypocalcemia in general. And then certain toxins are known to cause tremors and rigidity, things like tetanus, strychnine poisoning, or even venom from something like an eastern coral snake, though that's obviously geographically limited.
The sheer number of other possibilities really emphasizes why a thorough workup is so important, doesn't it?
It absolutely does. You can't just jump to conclusions.
So I imagine blood tests and urinalysis are a key part of this investigative process.
They are indeed. Very central. While routine blood work like a CBC and chemistry panel and urinalysis results are often normal in animals with hypoparathyroidism, they are absolutely essential for ruling out many of those other conditions we just talked about.
So they help eliminate other causes.
Exactly. The initial clues from blood work that might point towards hypoparathyroidism are finding low levels of calcium. Typically, the source says below 6.5 milli-GDL, along with phosphorus levels that are either normal or maybe just mildly to moderately higher than normal.
Okay, low calcium, normal, or slightly high phosphorus. And our source specifically mentions checking albumin levels too. Why is that?
Yes, that's crucial. Albumin is a major protein in the blood, and a lot of the calcium circulating actually binds to it.
Uh,
So if albumin levels are low for some other reason, like liver or kidney disease, it can lead to a lower total calcium reading on the blood test, even if the ionized calcium, the active unbound form, is actually normal.
so you need to make sure that the low calcium isn't just because of low protein?
Precisely. We need to interpret the calcium level in light of the albumin level. Also, while kidney failure can also cause low calcium and high phosphorus, it's usually pretty easy to tell apart because kidney failure will also show up as increased waste products in the blood, high BUN and creatinine, something we call azotemia.
Right, you'd see signs of kidney failure too.
Yes. And there's also the less common situation where using phosphate-containing enemas could temporarily mess with these levels, but that's usually clear from the history.
Okay, so low calcium and normal to high phosphorus can be suggestive. But what's the test that really confirms a diagnosis of hypoparathyroidism? The gold standard.
The definitive test, the one that really nails it, is measuring the level of parathyroid hormone, or PTH, in the blood.
Measuring the hormone itself.
Exactly. In true hypoparathyroidism, where the glands aren't working, we will see either undetectable or very, very low levels of PTH.
And that's different from other causes of low calcium.
Yes, that's the key differentiator. In many other conditions that cause low calcium, like kidney disease or even eclampsia, the PTH level is usually normal or even elevated as the body tries its best to compensate and stimulate calcium release.
So low calcium PLUS, low PTH, really points to the parathyroid glands being the problem.
That's the diagnostic combination you're looking for. Confirms primary hypoparathyroidism.
What about using imaging techniques like X-rays or ultrasound? Are those typically helpful in diagnosing this?
Generally speaking, no, not for diagnosing primary hypoparathyroidism itself. X-rays and ultrasounds of the neck area where the glands are usually normal.
So they're more useful for ruling other things out.
Exactly. They might be used to investigate some of those other conditions we mentioned as potential alternative diagnoses, like looking for tumors or other issues.
Our source also mentions that there could be changes seen on an ECG, an electrocardiogram. How can those findings help?
Right. Because calcium plays such a critical role in how the heart muscle contracts and conducts electricity, low calcium levels can lead to specific patterns on an ECG.
What kind of patterns?
These might include certain parts of the heart's electrical cycle appearing longer than usual, specifically the ST and QT segments. You might also see a slower overall heart rate, sometimes changes in the shape of the T wave, or occasionally this thing called T-wave alternans.
So characteristic changes, but not diagnostic on their own.
Correct. While these ECG changes aren't enough to definitively diagnose hypoparathyroidism alone, they can certainly add to the suspicion, especially when seen along with low calcium levels in the blood. They fit the picture.
And in more involved procedures, like if a surgeon were to actually explore the neck area,
Yeah.
is that ever done?
It's rare for diagnosis, but in some cases, maybe if the diagnosis is still unclear after other tests, or perhaps if there's a concern about a specific lesion, a surgical exploration of the neck could reveal that the parathyroid glands are either absent or much smaller than they should be, atrophied.
Okay. Finally, what might a biopsy of the parathyroid glands show under a microscope if one were taken?
Good question. In dogs where the cause is immune-mediated, which is common, a biopsy would typically show otherwise normal gland tissue that's been infiltrated by immune cells, lymphocytes, plasma cells, and maybe some scar tissue fibrosis. You'd also see damage to the main cells that produce PTH, the chief cells.
So evidence of that immune attack.
Exactly. In cats, especially those with the spontaneous form, the most common finding is simply that the parathyroid glands have shrunk significantly, just atrophy. However, in some feline cases, you might also see those same immune cells and tissue damage that we typically associate with the canine form.
Okay, so once a diagnosis of hypoparathyroidism is definitively made, what's the general approach to treatment and management?
Well, the first step, especially if the animal is showing significant signs like seizures or severe twitching, usually involves getting them hospitalized.
For stabilization.
Right. To quickly bring their calcium levels back up into a safer range using intravenous calcium and get those clinical signs under control. The immediate goal is usually to get their blood calcium above about 7 milligdl. This might involve emergency care and giving them fluids through an IV as well, reporting them that way.
Okay, so initial emergency care if needed. And what about the ongoing care once they're stable and potentially can go home?
Ongoing care is mostly supportive initially, making sure they're eating and drinking okay, staying hydrated if they're still recovering. Once they're feeling better, normal activity is generally encouraged. There isn't usually a need for strict rest.
What about diet? Any special food recommendations?
When it comes to diet, the main thing is usually to avoid foods that are very low in calcium. For dogs, sometimes puppy food is suggested because it often has a higher calcium content than standard adult dog food, which can help a bit.
I see. And I know that medications like vitamin D and calcium supplements are usually a big part of the long-term plan, right?
That's absolutely right. They are the cornerstones of long-term management for primary hypoparathyroidism.
So tell us about the vitamin D. Why is that needed?
Vitamin D preparations are essential because they help the body absorb calcium from the food they eat, primarily in the intestines. Without enough active vitamin D, they just can't pull enough calcium in.
Okay. Are there different kinds?
Yes, there are a few different types vets might use. Calcitriol is a very active form of vitamin D, and it works relatively quickly, which can be an advantage. Ergocalciferol, or vitamin D2, is another option, though it takes a bit longer to have its full effect. Our source also mentions dihydrotestosterol, DHT, but notes that it's not readily available right now.
Is one better than another?
Veterinarians often prefer the shorter-acting forms like calcitriol because if the dose accidentally ends up being too high and the calcium levels creep up dangerously.
Which can happen, right? High calcium's also bad.
Exactly. Hypercalcemia is also a serious problem. So with a shorter-acting form, if you stop giving it, the effects will wear off more quickly, making it easier to manage an overdose.
That makes sense. And then they also need to get calcium directly through supplements on top of the vitamin D.
Exactly. Oral calcium supplements are really important for actually providing the calcium that the vitamin D helps absorb. They work together to raise and maintain those healthy calcium levels in the blood.
Are there different types of calcium supplements too?
Yes, various forms are available like calcium carbonate, calcium gluconate, calcium lactate, calcium acetate, citrate, glutamate, lots of options.
Does it matter which one?
The most vital thing to understand is that the correct dose needs to be calculated based on how much elemental calcium the actual calcium itself is in each specific type and size of supplement. Different forms contain different percentages of elemental calcium.
So the vet needs to figure out the right dose based on the specific product.
Precisely. It's something important for owners to be aware of too, especially if they ever need to switch brands or forms. Always check with the vet.
It sounds like a lot of clear communication and education with the pet owner is absolutely critical for managing this long term.
It's absolutely paramount. For dogs and those rare cats that develop primary hypoparathyroidism on their own, owners need to understand that lifelong treatment with both vitamin D and calcium, along with regular checkups and blood tests, is usually necessary. It's a commitment.
But what about the cats who get it after thyroid surgery? Is it different for them?
Yes, and it's really important to highlight this difference. For cats who develop this after thyroid surgery, the iatrogenic cases, the situation is often very different. In many, many of those cases, the condition is temporary.
Temporary, so they can recover.
Yes, the remaining parathyroid tissue, or maybe tissue that was just stunned by the surgery, can often recover function. It might resolve within days, weeks, or sometimes months. So they might only need medication for a relatively short period while those glands recover.
That's a huge difference in the long-term outlook and management.
It really is a key piece of information for owners of cats undergoing thyroidectomy.
So for those pets with the primary, likely lifelong form of hypoparathyroidism, is it just a matter of giving these medications consistently, or are there adjustments?
Oh, adjustments are common. Long-term therapy involves giving vitamin D regularly, indefinitely usually, but the doses often need to be fine-tuned, especially in the beginning, based on how the calcium levels are responding on follow-up blood tests.
Trying to find that sweet spot.
Exactly. Vets might also try to maximize the amount of calcium given orally and use the lowest effective dose of vitamin D, partly because calcium supplements tend to be less expensive than some of the prescription vitamin D preparations, so it can be more economical long-term.
Makes sense. Are there any situations where these medications might not be the best choice, or any major side effects to watch for?
Well, our source refers to general guidelines for treating low calcium, so the same precautions that apply to any case of hypocalcemia would be relevant here. In terms of side effects, giving calcium orally can sometimes cause stomach upset, like vomiting or constipation in some animals.
Anything help with that?
Some forms, like calcium carbonate, might be less irritating for some pets. It can sometimes take trial and error to find the best tolerated form and dose schedule. There are also potential interactions if injectable calcium is needed in an emergency along with certain other medications.
Like what?
For instance, using certain diuretics, thiazide specifically, along with high calcium doses, can potentially cause high calcium levels. And there's caution needed when giving calcium, especially IV calcium, to patients who are also on digitalis heart medications due to the risk of arrhythmias. Calcium can also counteract the effects of calcium channel blockers.
Okay, so things the vet needs to consider based on other health issues or medications.
Definitely.
So you mentioned follow-up blood tests. Regular monitoring of calcium levels sounds really essential then.
Absolutely essential, non-negotiable, really. Once the calcium levels are stable and within the target range, usually aiming for that 8 to 10 mg/dL zone, vets typically recommend checking blood calcium levels, say, every month for the first 6 months.
And after that initial period.
After that, if things are going well and the levels are stable, the frequency might decrease to maybe every 2 to 4 months for ongoing monitoring, but regular checks are still needed lifelong for primary cases.
And owners need to know what to watch for at home too, right?
Critically important. Owners must be educated about the signs of both low calcium, like returning twitching, seizures, anxiety, and high calcium.
What are the signs of high calcium?
High calcium or hypercalcemia can cause things like increased thirst and urination, lethargy, poor appetite, vomiting, and potentially constipation. If it gets severe or chronic, it can lead to kidney damage.
So owners need to be able to recognize problems early and contact their vet immediately.
Yes, prompt communication is key for making dose adjustments before things get serious.
Is there anything that can be done to prevent primary hypoparathyroidism from happening in the first place? Can we stop the immune attack in dogs, for instance?
Unfortunately, no. Because the underlying cause in most canine cases is thought to be an immune issue, and the reasons behind spontaneous cases in cats aren't well understood, there aren't currently any known ways to prevent primary hypoparathyroidism.
But what about the surgical cases in cats?
Right. In cats undergoing thyroid surgery, careful surgical technique to identify and preserve at least one parathyroid gland, or to autotransplant one if needed, is crucial for minimizing the risk of post-operative iatrogenic hypoparathyroidism. That's where prevention efforts are focused.
What are some of the main potential complications that can arise with this condition or its treatment over the long term?
The main potential complications really revolve around calcium control. You can have recurring episodes of low calcium hypocalcemia, even with treatment, if the dose isn't quite right or something changes. And then there's the opposite problem, developing high calcium levels, hypercalcemia, from the treatment itself.
And that high calcium can cause kidney damage.
Yes. Chronic hypercalcemia can lead to mineralization of the kidneys and potentially kidney failure over time. That's why the regular monitoring is so vital to catch high levels early.
But overall, putting it all together, what's the general long-term outlook for pets who are diagnosed with hypoparathyroidism? Can they live a normal life?
With careful monitoring of calcium levels and, really importantly, excellent owner compliance with giving medications and attending checkups, the long-term prognosis is generally considered very good to excellent, especially for primary hypoparathyroidism. They can live long, happy lives.
That's great news.
Yeah. As we mentioned, it's common for medication adjustments to be needed, particularly in those first few months after diagnosis while things are getting stabilized. But once stable, management is usually successful.
And for the cats with the post-surgery type?
Right. It's really important to reiterate that for cats who develop hypoparathyroidism after thyroid surgery, the prognosis is typically excellent. Most regain normal parathyroid function within a few weeks or months, and often only need temporary treatment, if any.
So to kind of wrap it all up, bring it all together, we've learned that hypoparathyroidism is basically a shortage of calcium in the blood because the body isn't making enough parathyroid hormone.
That's the core issue.
The most common causes are different in dogs, and cats usually immune problems in dogs, often surgical complications after thyroid removal in cats.
Key difference there.
The signs can vary quite a bit, often affecting the nervous system with twitching or seizures, muscles causing weakness, but also potentially things like cataracts in the eyes or changes in thirst.
Wide range, yeah.
Careful testing, especially measuring both calcium and PTH levels, is needed to confirm the diagnosis and rule out a lot of other possibilities.
Essential for diagnosis.
And while long-term treatment with vitamin D and calcium is often required for the primary form, needing careful monitoring.
And owner commitment.
Right. The overall outlook is generally positive, particularly for those cats who develop it temporarily after thyroid surgery, where recovery is common.
Exactly. The key takeaway is recognizing the possible signs and getting your pet to the vet promptly if you have any concerns. Early diagnosis and treatment make a huge difference.
Absolutely. And on that note, it really makes you think, given how finely tuned the body's hormones are, this whole endocrine system, what other seemingly unrelated health issues in our pets might have these subtle hormonal connections that maybe we're only just beginning to uncover in veterinary science?
That's a fascinating thought. The body's interconnectedness is incredible.
Definitely something to consider. Thanks for tuning in to this deep dive.